Margaret spent 6 nights in the hospital. She had her own room, a wristband with her name on it, nurses checking her every few hours, a doctor reviewing her charts each morning. She ate hospital food, slept in a hospital bed, and watched the same ceiling tiles for almost a week. When she was finally well enough to leave, the staff told her she would need a few weeks of rehab at a skilled nursing facility to get her strength back. She wasn't worried. She had Medicare. She had paid into it for 40 years. And then the bill arrived. Not a few $100s. Not 1,000. More than $20,000. Margaret did everything right, and one single word on a form she never saw turned her Medicare coverage into almost nothing. That word was observation. And by the time most people learn what it means, the money is already gone. Here is the trap, and I want you to understand it clearly, because it is happening to hundreds of thousands of seniors every single year, and almost none of them see it coming. When you go into a hospital, you assume you have been admitted. You are in a bed. You are being treated. Of course you have been admitted. But in the eyes of Medicare, there are two completely different ways to be in that exact same bed. One is called inpatient. That means the hospital formally admitted you, and Medicare Part A, your hospital insurance, kicks in the way you expect. The other is called observation status. It means that even though you are lying in a hospital bed, receiving care, eating hospital meals, and being watched around the clock, the hospital has technically classified you as an outpatient. You are a visitor who happens to be staying overnight. And that single classification changes everything about what you will pay. Now you might be thinking, what difference does a label make? I am in the same bed either way. And you would be right about the care. The nurses treat you the same, the doctors treat you the same. But the billing is a different universe. Under observation status, your stay is covered under Medicare Part B instead of Part A. That means you face co-pays for every individual service. Every test, every scan, every bag of fluid becomes its own line item with its own out-of-pocket cost. And the medications they give you, the routine pills you take every day at home, can be charged to you at full hospital pricing, because Part B does not cover them the way Part A would. People have been billed dozens of dollars for a single aspirin. But that is not even the part that bankrupts people. The part that bankrupts people comes after you leave the hospital. This is the heart of the trap, so stay with me. Medicare has a rule that almost nobody knows about until it is too late. It is called the 3-day rule, sometimes called the 3-midnight rule. Here is what it says. Medicare will only pay for your stay in a skilled nursing facility, that is rehab, physical therapy, the place you go to recover if you first spent at least 3 consecutive days as a formally admitted inpatient in the hospital. 3 midnights, admitted. Not observation. Inpatient. And here is the cruel twist. Those nights you spent under observation, even if there were 5 or 6 of them, do not count. They do not count at all. So Margaret, who spent 6 nights in that hospital bed, had 0 qualifying inpatient days. In the eyes of Medicare, she was never really admitted, and so when she went to rehab, Medicare paid nothing. The full cost, $20,000 and more, landed on her. Let me say that again, because it is so important and so unfair that people refuse to believe it the first time they hear it. You can spend a week in a hospital, get excellent care, follow every instruction, and still not qualify for nursing home coverage, simply because a hospital decided to write the word observation instead of the word admitted on a form you were never shown. The care is identical. The bed is identical. The only thing different is a billing classification, and that classification can cost you the price of a new car. So why would a hospital do this? Why would they put you under observation when you are clearly sick enough to be in a bed for days? The answer is not that hospitals are cruel. The answer is that hospitals are afraid. Years ago, Medicare started auditing hospitals aggressively. Government contractors would go back through old records and decide after the fact that a patient should not have been admitted as an inpatient. When they made that decision, they would claw back the payment, sometimes the entire amount, and penalize the hospital. So hospitals learned to protect themselves. They learned that observation status is safer for them. It draws fewer audits and fewer penalties. So when your case is anywhere in the gray area, the financial pressure pushes them toward observation, toward the choice that protects the hospital, and quietly transfers the risk onto you. You become the one holding the bag, and you do not even know the bag exists. Now you may be wondering, surely they have to tell me. Surely someone has to warn me that I am under observation and not admitted. And there is a law about this, but I want you to understand exactly how weak it is. Hospitals are required to give you something called a Medicare Outpatient Observation Notice, often called the MOON. If you are kept under observation for more than 24 hours, they must hand you this form and explain it. But think about when this happens. You are sick. You are scared. You are full of medication and you cannot sleep, and you are worried about whether you are going to be okay. And in the middle of all of that, a staff member hands you a piece of paper, has you sign it, and moves on. Most people sign without reading. Most people do not understand what they signed. And critically, signing the form does not give you any power to change your status. It is a notification, not a negotiation. They are telling you that you are about to be charged, not asking your permission. So what can you actually do? Because I do not want to just frighten you. I want you to walk away from this knowing how to protect yourself and the people you love. The single most important thing is this. The moment you or a family member is in the hospital and likely to stay overnight, you ask one direct question, and you ask it out loud, and you write down the answer. The question is, am I being admitted as an inpatient, or am I under observation? Ask it on the first day. Ask it again the next morning. Ask it every single day you are there, because your status can change from one day to the next, and nobody is obligated to chase you down and tell you. You have to chase them. If they tell you that you are under observation, do not just accept it quietly. Ask to speak with the hospital's case manager or patient advocate. Say, clearly and calmly, that you are concerned about your status because of the 3-day rule and skilled nursing coverage. Those words matter. When you say them, the staff knows that you know, and that changes the conversation. Ask your own doctor, the physician who knows you, whether your condition justifies inpatient admission, and ask them to advocate for that classification with the hospital. Doctors have more influence over this than the billing office wants you to believe, but they often will not push unless someone asks them to. And if you are leaving the hospital headed for rehab, do not assume anything is covered. Before a single day of skilled nursing care begins, confirm in plain language how many qualifying inpatient days you had. If the answer is fewer than 3, you need to know that before the bills start, not after. Because once you are in that facility racking up charges, your options shrink fast. Let me tell you about another person this happened to, because Margaret is not rare. Harold was 72, a retired mechanic, the kind of man who never missed a payment in his life. He fell at home and broke his hip. He spent 4 nights in the hospital, had surgery, and went to rehab to learn to walk again. He assumed, like anyone would, that 4 nights in a hospital after major surgery meant he was covered. He was under observation for 3 of those 4 nights. He had 1 qualifying inpatient day. He needed 3. His rehab bill came to $26,000 and Medicare paid none of it. Harold told his daughter that the worst part was not even the money. The worst part was that nobody ever told him. He signed a form in the emergency room at 2 in the morning, groggy and in pain, and that signature was the only warning he ever received. He never had a chance to fight, because he never knew there was a fight to be had. I want you to understand the scale of this, so you know it is not some rare accident. Every year, hundreds of thousands of Medicare patients are placed under observation status. The number of long observation stays, the ones that stretch past 48 hours, has climbed dramatically over the past decade. This is not a glitch. It has become a routine part of how hospitals manage their financial risk. And the people who pay the price are almost always the ones least able to absorb it. Retirees living on fixed incomes, people who counted on Medicare being there exactly when they needed it most. And there is one more wrinkle that catches people off guard. Many seniors today are not on traditional Medicare at all. They are on Medicare Advantage plans, the private plans you see advertised constantly on television. Those plans have their own rules about prior authorization, their own networks, and their own ways of deciding what counts and what does not. Some have softened the 3-day rule, but many have their own traps and their own denials. So whether you are on traditional Medicare or a private Advantage plan, the lesson is the same. Never assume, always ask, always get the answer in writing. Here is something most people do not realize. You can appeal. If you were placed under observation and it cost you, you have the right to challenge it. For years, seniors fought this in the courts, and in a major case, a federal court finally ruled that patients have the right to appeal their observation status to Medicare. That was an enormous victory, and it means you are not powerless. If this has already happened to you or someone you love, you can request a review, you can submit your records, and you can fight to have those days reclassified. Many people have won. But you only get that chance if you know the right exists, and now you do. I want you to sit with what a bill like this really does to a person, because it is not just a number on a page. For someone living on a fixed income, $20,000 is not an inconvenience. It is a catastrophe. It is the savings you spent 40 years building, gone in a single week. It is choosing between the medication that keeps you alive and the heating bill in January. It is the quiet shame of having to call your son or your daughter and ask for help, when your whole life you were the one who helped them. Some seniors put these bills on credit cards and carry the interest into their final years. Others simply refuse the rehab they desperately need, going home too weak, and end up back in the hospital within weeks, sometimes with a fall that changes everything. The cruelty is not only the money, it is that the system punishes the people who did everything right, who paid in faithfully, who trusted that the coverage would be there. That is why this matters so much, and why I need you to know how to fight back. So let me walk you through exactly how to appeal, step by step, because you are not powerless, and most people never learn this. First, while you are still in the hospital, ask for a copy of your medical records and any notice they gave you, including that Medicare outpatient observation notice. Write down the name of every person you speak to and the date. Second, if you have already been hit with a bill because of observation status, you can formally challenge it. For years, this was nearly impossible. But in a landmark case, the courts finally ruled that Medicare patients have the right to appeal their observation status. That ruling changed everything. It means you can submit your records to Medicare, explain that you were kept under observation when you should have been admitted, and ask them to reclassify your stay. Third, do not give up after the first no. Appeals have levels, and many people who lose at the first stage win at the second or the third, especially when a doctor writes a letter supporting that you needed inpatient care. Keep every document. Be persistent. The hospital is counting on you being too tired and too overwhelmed to fight. Prove them wrong. And here are the exact words to use, so you are never caught off guard again. The moment you or someone you love is admitted to a hospital and likely to stay the night, look the staff in the eye and ask, clearly, am I being admitted as an inpatient, or am I under observation? Then ask them to write the answer down. Ask it again the next morning, because your status can quietly change overnight. If they say observation, say this calmly and firmly: I am concerned about my status because of the 3-day rule and my skilled nursing coverage, and I would like to speak with the hospital case manager and my attending physician. Those words tell them you know exactly what is at stake, and the conversation changes instantly. Ask your own doctor whether your condition justifies inpatient admission, and ask them to advocate for it. Keep a small notebook by the bed with the date, the status, and every name. It feels awkward to push when you are sick and scared. Do it anyway. That notebook and those few questions can be worth $20,000. Let me leave you with this. The word observation sounds harmless. It sounds like someone is simply keeping a careful eye on you, watching out for you, making sure you are safe. And that is exactly why it is so dangerous. It hides in plain sight, on a form you sign while you are at your most vulnerable, and it quietly rewrites the rules of the coverage you spent your whole life paying for. Margaret learned what it meant only after the bill arrived. You learned it today before you ever need it. So remember the question: am I admitted or am I under observation? Ask it, write down the answer, and ask it again tomorrow. That one question, asked at the right moment, can be the difference between the coverage you earned and a $20,000 bill you never saw coming. Share this with someone you love who is on Medicare, because the next